Yeah. So, as someone working on the ground every day with Saved by the Plate, I see firsthand the struggles and strengths in our community. People are finding ways to grow food, build local food businesses, and keep their families healthy despite impossible odds. But policy shifts like the One Big Beautiful Bill make these harder, cutting back on supports like SNAP and nutrition education. That's why this conversation really matters. It's not just about food, it's about dignity, health, and the future of our borough. I have to cut in and say I do not actually live in the Bronx. I live in Harlem.
Thanks for the support.
No problem. Anytime. Love the Bronx. There's some really dope community gardens here in the Bronx. Tonight is also about lifting up social innovators, neighbors, and advocates who are already showing us the way forward. Thank you.
Hello everyone, my name is Janani. I'm one of the interns with FoodStream Network. And so over the past 2 months, a team of us, Joanna, Rick, who's in the audience, Rich, Dani, Shay, and a couple more people on our team have been working on a policy brief. You can find a link to the policy brief on the handouts if you scan the QR code, but it is a 22-page document. Encourage you to all read it. But for right now, I'm going to give you a quick rundown of the research that we've done. So the One Big Beautiful Bill, that's why we're all here. It is a very, very long bill. That's why it's called big. And people are very confused. They're still grappling with what it means. And so far, here's what we know. So it's estimated that $206 billion will be cut from the federal spending over the next 10 years. And in addition, a large portion of administrative responsibilities will be shifted to state and local governments with SNAP, which is very relevant to a lot of us in the food space, will be carried, 15% of the cost will be carried by the states. And 75% of the administrative burden will also be carried by the states. And this is predicted to have, to create like a lot of budgetary holes in the government and so on. Programs like SNAP and Medicaid have also been subjected to strong work requirements, which is predicted to take away SNAP and Medicaid from over 130,000 New York City residents. And among them are some of the most vulnerable people: asylum seekers, people with temporary protected status, and people who have who are veterans, people with disabilities, who are not exempt from work requirements. Also parents who have children above the age of 14. In addition, SNAP Ed, which is a very important program that has been bringing nutrition education, food education to the people of New York City and to the children of New York City to teach us how to eat a healthy diet and how to live a healthy life in a food system where we have been alienated from important knowledge, important production sources and so on, has been completely slashed. This means that organizations like the Food Bank of New York City will not have funding to execute these programs, and that might cause devastating effects down the line. With rising food costs and cost of living, we are grappling with these changes and thinking about how this might affect people who are vulnerable, who are already struggling to afford food, afford living in this very expensive city once these cuts happen. But not all is lost. We have gathered here because we all have hope, we all have an enterprise, we all have intelligence and ideas and community. And with that, I would like to introduce this amazing panel of people who have been working hard towards this mission of making sure that every New Yorker has access to healthy food. Yeah. So let's just start with introductions.
Hello everyone, I'm Dani from the Bronx, and my one-line intro is usually, and I'm a recovering former bureaucrat. So I actually used to work in these 8 systems, and now I am co-founder of Lulo. We're a social impact tech venture born out of Blue Ridge Labs, a tech innovation arm of the Robin Hood Foundation, and we're dedicated to helping families eligible for the WIC, the Women and Infants Children Program, fully access food benefits. About $1 billion a year, 40% of benefits are left behind. So not just does that mean less food on tables for families with children under the age of 5, pregnant folks, postpartum folks, that also means less revenues for our local economies. But a big thing that we're going to talk about here is the importance of systems and also of data. And so while this tool is incredibly valuable and useful, we also have our eye towards systems change. And so Lulo being a hybrid organization, I also run the WIC Data Project, supported by the New York Women's Foundation and the New York Health Foundation, to leverage Lulo's data to help improve WIC program delivery and create more efficiencies for our families and our community organizations.
Yeah.
Kept it short.
Hey y'all, I'm Aura from the Bronx.
Hey.
I am a Castaneda Fellow and I serve as Senior Policy Advisor with the New York City Mayor's Office of Food Policy. Within my portfolio includes a few key and strategic areas that are all really grounded in the principles of food as a human right. One of them being food security. So in addition to supporting our community organizers who do the work of feeding over 1.7 million food insecure New Yorkers, I also support with advising leveraging of data to help inform things like the budget and allocations for emergency feeding through the Community Food Connection Program. I also oversee our data analysis for the supply gap. So it's an annual assessment that looks at the supply of emergency food paired with the need for emergency food and determines where our greatest deficits and surpluses exist across all 197 neighborhood tabulation areas where New Yorkers live. In addition to the Emergency Food Network, I also oversee the Department of Corrections and Administration for Children's Services. So feeding the people who are in the full care of our city and making sure that their teams, including their culinary staff, get access to things like culinary education and skill building to make sure that those jobs are good jobs. In addition to those 2 fields of work, I also work with food rescue and our food waste reduction strategies. So this is introducing policies and practices to ensure that more of the food coming into New York gets onto our plates and out of our waste stream. This includes things like the Hunts Point Produce Market redesign, which is being worked through right now. I'm very involved in the process of creating the language for that RFP to ensure that we have a zero waste facility. So our goal as a city is to ensure that the millions of pounds of surplus food that doesn't get onto our grocery store shelves or doesn't get into our restaurants is funneled onto plates by leveraging things like the Emergency Food Network or upcycling of food. So turning things into alternative food products, turning them into shelf-stable products, or converting them into animal feed or energy that can then be used for the city.
Hi everyone, I'm Alyson Rosenthal. I'm a registered dietitian and also a recovering former bureaucrat. I worked at the city's health department for 7 years, a little while back. And still in recovery. But I've worked in the city for over 2 decades now, all on different programs and different policies that help to expand access to healthy foods for all New Yorkers. I'm currently the Chief Program Officer at the WSCAH Campaign Against Hunger. We're one of the largest and most impactful emergency food providers in New York City. Every year we're providing over 5 million pounds of food to over 100,000 New Yorkers in need. And really what sets us apart from probably over 1,000 emergency food providers in the city, but certainly over 700, is that we really put dignity at the center of everything that we do. And we only are providing healthy foods for our community. So we really are putting dignity, but also health at the center of our work. And we also are looking to transform the system so that it's not just the people that we're directly serving that are being impacted, but that we can work across New York City, the state, and the nation to really make changes that improve hunger across the board.
Nice.